Take your seats. All right. All right, before we start, I have one question. Are you guys ready for the Annie show? Yeah, all right. We're ready to rock and roll here. I love that. I do have a lot of stamina. You can't kill me. I think you realize that, okay? But one of the things is that this side of the projector is better than the other one, because some of the pictures I'm going to show, and it's a very visual presentation, are going to be really redded out. If you want to take a look at what they look like, my computer shows the original picture, but you know, listen, sometimes things are not perfect. We just have to deal with it. So what I'm going to be talking about here is a presentation that is the Annie Show, and it's about gender transition as seen through my eyes, my experience. So what I'm going to do here is I'm going to share my personal transition and story. I know we have some people here today who were with me last night. I apologize for basically kind of the same imagery, but I will change up some of the dialogue, and I'd also give you a chance to fire away with some questions. I'm going to put in a couple of little sidebars, but what I want this more than anything else, I want you to understand how dramatic a change can be. Yes. Just to make sure the videos are in the audio. Hold on for a second, everybody. I guess we weren't quite ready for the Annie show. Let me just check one thing here. Ready? Hold on for a second. We have to have an audio check. Right? That's what we call in the business a tease. Okay. You want the other one too? Oh, okay. What's that? Okay. Okay. All right, take your seat. So what I'm going to do, I'm going to do the Annie show. And then what I want to do is I want to talk about LGBT advocacy. And I want to talk about how you can be supportive, not just of your patients, but how you can be supportive of colleagues and or relatives of people undergoing such a transition, okay? So, having said that, let's start. This is, of course, the disclaimer, which we have now on anything we talk about. And I always like to start with this picture. You know what this is? This is my brother and me in 1951. So I know what you're thinking. You know what you're thinking? Wow, this bitch is old. I got it. I got the memo, okay? So that was 1951. Great brother. He's still alive, fortunately. As a retired detective, lives in upstate New York in Adirondack Park. Great brother. So growing up, grew up on Long Island. I loved the water. I could swim before I could talk. Great memories. But it was around age 4.5 where I had these feelings, and certainly by 5 years old. And you have to realize, for me, I was a really rough and tumble little boy, and I was a good, you know, athletics at that time, even though it's minor, but I was also a good student. And as I went through junior high school and everything, I had been skipped a year in school. So because of academics, I get skipped a year ahead in school. So I then ended up in high school at 14 years old. And all I cared about were two things, athletics and academics. I was a really, really good athlete, and I was a really good student. So everything was fine. I had no interest in girls. First date I ever had, and it was strictly peer pressure, was the junior prom. And in the junior prom in those years, your father would drive you and your date to the junior prom. And I remember my father was driving me to the junior prom, and of course my date was a cheerleader. And it was such a disaster. And one of the reasons that's a disaster in retrospect is that my date had a date, meaning me, and I'm looking at it thinking, oh my gosh, that dress must be so wonderful to wear. That's not really what you want if you go into a junior prom. So that was really pretty unpleasant. But you know, one of the things that going through grammar school and junior high school, I was so busy with academics and sports, any feeling I had, and I would read anything that I could find about sex changed people, and I would hide it in my room. And at the time, there were some people who had gone to Denmark and had a procedure done and had a lot of tabloid newspapers, and I would save all that stuff. But to give you an idea how overwhelming this is, if it's a legitimate diagnosis, is the following. I was a great athlete, like in Little League and all these type of things and midget football, and a great student. But at night, when I was 10, 11 years old, I used to say a prayer, like a lot of little boys and girls do. You know what my prayer was? My prayer was, God, please make me a professional baseball player or a girl. Think about that. That's an incredible dichotomy. It wasn't like, please make me a professional baseball player or a fireman. It was like, please make me a professional baseball player or a girl. Later on, I did have the opportunities for professional baseball as a draft choice, and I chose not to go in that. And then the other thing actually came true. So Truman Capote was not necessarily wrong when he talked about answered prayers. But that's what I did every night with that kind of prayer. Then as I got into high school, I didn't go to some kind of chump change high school. I went to a high school, and the time was a regional high school in Long Island. We had more than 600 kids in my class. That's a big school, okay? So I was only the second person in history of the school elected to honor society as a sophomore. And I was the youngest varsity starting football player on Long Island. I was 14 years old. So I'm 14 years old, starting at a big high school and varsity football player as a halfback. And yet, at my room back in my house, like a lot of boys that age, I had a bunch of magazines under my bed, right? And so the guys here in the audience, or if you have brothers, you know, they have a lot of magazines underneath their bed, and they're like Penthouse and you know, Playboy and things like that. I had a gazillion magazines underneath my bed, and they were all Vogue, right? And what I used to do is I used to redesign dresses. I would sit at my desk and I would redesign them. And it was really funny because, as I related yesterday, my mother one time discovered this, and she had a huge problem. And I heard her kind of like verbally attack my father. And she said, Woody, that's what my dad's name was, Woodrow, you have to go upstairs and speak to your son. And he said, why? And she goes, he's designing dresses. And my father's response was wonderful. He was like, so, right? He's not like cutting the heads off of cats, right? So it's like, you know, it's a big deal. But she wouldn't have anything of it. So I could feel my father trudging upstairs. And of course, as I said yesterday, I rearranged all my papers on my desk, closed the door, kept it a little open ajar. And he came up, and he never did this before or after, knocks on my door. And he goes, son, never called me son, it was always Ken. So he said, what are you doing over there? So I turned and very confidently said, well, I'm doing my social studies homework. So he goes, is everything okay? I said, yeah, everything's fine, Dad, it's great. Oh, okay, thanks. And he turned around and walked downstairs. And as soon as he got downstairs, my mother was on him like bees on honey. But he just, you know, walked away from it. But that's the kind of effect it has. The good news for me, I had no problem compartmentalizing it. The bad news for a lot of transgender individuals is they can't compartmentalize it, and it makes them dysfunctional. Not only dysfunctional, leads to depression, severe depression, anxiety disorders, and even suicide contemplation. So for me, I was able to compartmentalize it. I had a really great productive life as a kid growing up in junior high school and high school. I showed this picture yesterday because this is what proms looked like in 1967. So this was the senior prom. This person ended up, I ended up marrying her. She's still a good friend. She's actually a periodontist out here on the West Coast. So, right? So this is the typical high school picture, right? And I was known as what they called at the time like a scholar athlete. I was literally all Long Island in 2 sports. I had 8 out of 9 letters. I played basketball in the winter. Sophomore year, I didn't play basketball because I played in the junior hockey league, but I was all Long Island in both football as a quarterback and as a catcher in baseball. So, you know, to me, all this stuff is going on, but I realized something's not really quite right here. How come I have these feelings? But you couldn't share that with anybody. This is 1966, 67. You just could not bring anything remotely like that to the forefront. So as I said yesterday, a couple of people recognized that this is the former Heisman Trophy winner for West Point. His name was Pete Dawkins. So this is a picture taken. I was receiving a couple of awards, athletic awards in Long Island. And Pete Dawkins got sent down to present the awards, and he tried to convince me to go to West Point. I ended up getting accepted to West Point, but 1967, West Point was a tough sell. Okay, it was a really tough sell with the Vietnam War. So I was flattered by his interest and West Point's interest, but I certainly had no interest in going there. And it's so amazing because years later, they started an Athletic Hall of Fame. And in the second class, I was one of the people chosen for the Athletic Hall of Fame. So I'm very, very flattered that that part of my life was acknowledged. And the reason I say that is because when I left high school and went off to college, I couldn't handle the locker room anymore. When I was in high school, there was never a team bus from Smithtown Central High School that would leave without me. I was the quarterback, I was the catcher, the point guard. So I could totally game the system taking showers. So I would always be able to take a shower by myself, have some kind of excuse. I got to go back, get something. The bus was never leaving. I go off to college, and my freshman year, I played football, ice hockey, and baseball. And then my second year, I played varsity ice hockey and varsity baseball. But at that point, that was it. I couldn't take the men's locker room anymore. Absolutely hated it, okay? And in high school, I could fudge it. But in college, wherever you go, everybody's all state, all this, all city, all universe. So it's a whole different situation. I'm in college as a 17-year-old kid, and there's 22, 23-year-old guys. So to me, that was just like the shit hit the fan. I'm walking away. So at my sophomore year, and I was only 3 sophomores on the baseball team, I walked away from all of athletics. So the coaches, baseball scouts, my parents couldn't understand, what are you thinking? What are you doing here? Your whole life has been athletics, and you're walking away from it. Walked away stone cold. And so as part of a kind of like a response, I grew a beard. So the same lady in the high school picture, the prom picture, I'm the guy in the middle, right underneath the moose with the beard. And the person with the kind of like, you know, antebellum, you know, Gone with the Wind dress, that was my girlfriend, who is now the periodontist. So that's what it was. And then, of course, this was in the time of a lot of political turmoil on campuses. This is like, you know, 1969, 1970. And again, one of the things that I'm still a firm believer in, not necessarily free love, but I'm a firm believer in tolerance. Understand different people's opinions. Don't go immediately off the countertop. Don't be so extreme. Understand different people's viewpoints. So that was college. And then from there, I went to dental school. And I'm not going to waste much time in dental school because we're all here in dental school. But I have to show you this picture. And as I always say to people, you know, there's a reason I wanted to show you this picture. I have a really good friend who's an African-American attorney in Philadelphia. She's a big deal attorney. She's wonderful. And she saw this picture at her presentation. And you have to understand the background. In Philadelphia, right near the Penn campus, there was a park. And the park is called Clark Park. And Clark Park is famous for 3 things: drug dealers, homeless people, and Hall & Oates, right? Because Hall & Oates used to do free concerts there. So when she saw this picture, she said to me, Annie, she said, I think this is the ideal picture of Hall & Oates combined in one compilation, right? And it kind of looks like Hall & Oates, but that's not the real reason why I'm showing you. Why am I really showing you this? Look at the jacket. Yeah. I mean, the 70s was a hideous fashion decade. It was painful. I mean, I'm not even showing you leisure suits, right? Well, I didn't do leisure suits. But this jacket with all these plaids and everything, and this is what we had to live with in the 70s. So if you have any relatives talking about the 70s and disco, give them a little bit of a break. It was a painful decade, okay? So then what happened after graduating from dental school, there was one space before I joined the service. My wife at the time was 2 years behind me in dental school. And so I was working in Philadelphia. And this was so interesting because I was working in a health clinic and I was really working in the hood. I didn't see another white person the entire year, only saw a couple of Spanish people. It was all African-American people. And this is something to be taken from this story. There was a person who came in for treatment, and I'm trying to do the most I can within the limits of DPA, Department of Public Assistance. And she was a beautiful young woman. And when she left, my front desk receptionist came back and they said, Dr. Kosh, we have a problem. I said, what's that? They said, well, your last patient's using the wrong DPA card. So they showed me the DPA card and it had a male name on it. So I went, not a problem. I went over to this young woman who looked like Diana Ross. I said, excuse me. I said, I think we have an issue. I think you accidentally picked up your brother's DPA card because this is the name. So very, just not even a nonplussed attitude. She looked at me, she goes, oh no, that's me. And it was a male's name. So I said, oh, okay. I didn't say anything about my inclinations or thoughts. I had to have her come back for some other treatment. And she came back and I really treated her like a princess. I really treated her well and professionally. Well, as I said yesterday, it was so amazing. And I didn't expect within about 3 weeks, I became the cosmetic dentist in Philadelphia for all the Black queens. Right? And it was so much fun. All these patients would come in and I would do all kinds of procedures on them, stretching the DPA rules. And in those days, Philadelphia had a burgeoning transsexual community. In fact, there was a guy doing the surgeries at Pennsylvania Hospital. I think his name was Moonahan. And there was a big thing on Halloween. Philadelphia does Halloween like no other city. And there's a big ball every year called Henry David's Ball. And Henry David is a custom jeweler downtown. And the theme for Henry David's Ball is, don't come as you are, but as you want to be. So you can imagine what kind of people show up at Henry David's Ball. And so I had a number of my patients introduce me to their mothers and everything. And in fact, first prize at Henry David's Ball, he would pay for the operation. So I had this whole exposure with this group. But I mention this because what happens when you treat these patients with respect and you accord and afford them the dignity that all patients deserve, they become really loyal, great patients. And I'm sure if you speak to some of some of the docs here at the school, they're going to tell you they treated one of these patients, treated them professionally. Next thing you know, there were 2 or 3 other referrals coming in. Okay, it's like a network. But I was very proud to do it, and it was really a lot of fun. So I left Philadelphia and joined the Air Force. So I went over to Tokyo, and that's where I was based, which is a pretty cool place in 1980. And ended up getting divorced from my first wife. And the problem was just kind of the relationship. She was a beautiful woman, smart woman, never had a problem, but I had no interest in her physically. And so, she wanted to go to counseling. And I don't know, I knew what the problem was. But I really didn't have the courage to say to her what the real problem was. So we ended up getting divorced, which you think, oh my God, you're together in a hospital overseas. It never became an issue. So I found myself single, and I don't mind working hard, and I like to have a good time. So I like to dance, and I was spending a lot of time in clubs in a weekend, and I was in a club one time, and a guy came up to me and said, hey, have you ever thought about modeling? I said, no. He said, well, listen, here's a card. If you have any interest, give us a call. So it was from a agency. So I went down, and in the first week, I scored 2 TV commercials and an editorial job. So that just set me off to the races. For 5 years, I worked as a model and a professional actor. And what I want to do is I just want to share with you some of this crazy fun stuff that I was able to do as Ken Koch. This was from a big campaign, catalogs and billboards. And I remember this picture. The guy shot 10 rolls of 36. So I gave more than 300 different poses with glasses, no glasses. They put sideboards, they're reflecting. That's what's done. And the guy's just shooting, the other guy's loading, shooting, loading, music's playing. It's tremendous fun. But here's the one I really want to share with you. Haha, what is this? What is this? All right. We didn't get a response like this last night, see? Now this is the Annie Show. This is an outtake from the commercial of the year in Japan in 1983. And this is for Casio watches. And I'm going to show the commercial for you, and then we're going to talk about it.
彼は50人の電話番号を覚えるこの時計さえあれば何にもいらないと申しております。男は腕に電話帳、カシオテレメモ50。
Well, um, after having done a commercial, I was known as Dr. Casio. But that was really a great commercial. Japan, they're fanatic about commercials, and it's a whole niche. So once you kind of become, quote, a talent or whatever, things happen for you, and they follow commercials, and they have magazines that follow it. So I did many, many interviews, and the most interesting thing was, the question that was most commonly asked of me was, did I keep the watch? And I didn't keep the watch because it was a really cheap watch, right? And what the guy in Japanese is saying is, when I'm walking to the phone booth, is that this watch did so many things that I forgot to get completely dressed. And it became a huge success and won a couple of other awards in other countries. But one of the things, as I said yesterday, I had a patient who was a pilot. He was a 130 pilot for the Air Force. And they were always jumping down to Hong Kong. So he came back, and he's in my chair, and he said to me, he said, "Hey, Doc, I was just down in Hong Kong." So I said, "Yeah." And he goes, "I saw you on a billboard." I did a lot of billboards, but I knew what he was talking about. So I said, "Oh, really?" He goes, and he turns and goes, "Yeah." And he goes, "You weren't wearing any clothes." So I said, "Well, just keep that a secret between you and me and 8 million Hong Kong Chinese." But it was so much fun doing things like this. The thing that was really crazy was I was actually in the Air Force. But what was really amazing was that the Air Force was really pleased to have me enjoying Japan. In fact, anytime they had colonels, especially generals, come in, I would be an escort for them in Tokyo. I knew Tokyo really well. And one time we had the general for the Air Force, he was a periodontist, and 2 colonels in the backseat of a taxi. I'm in the front seat, and amazingly, it was a female taxi driver, which was very rare at the time in 1983. So I was taking them to the Meiji Shrine in Tokyo. We stop, they're going to get out of the back seat. The driver grabs my hand, which is really unusual, and says to me in Japanese, "I know who you are, I need a sign." So she wanted an autograph, right? So I give the autograph to this taxi driver, and the general in the Air Force goes crazy. And then he says to me, "You can stay here as long as you want." Meanwhile, the other guys are like, "No, get rid of her, like, you get rid of him quickly." So it was just a kind of a charmed life. So that was really maybe the most outrageous commercial. This is my favorite commercial. This was a commercial done up north in Hokkaido where I was one of the Wright brothers, okay? And what the Japanese production company did was Dentsu, which is a pretty famous company. They found me in Tokyo, they found the other guy in London. And they went to the Smithsonian, they made an exact replica of the Kitty Hawk plane. They then wood grained it, and they brought in a big crane. And what they had is they had cables, and what they did is they spun the plane around. But when you shoot film, you don't see the cables. And this was for the #1 TV commercial in all of Asia by Beat Takeshi. He was a comedian. And this is for a coffee creamer. And I'm not kidding you. The name of the creamer was Creep, right? Or they pronounce it in Japanese, katakana, Kuripu, okay? And that's what it was. But take a look at this. Was a beautiful commercial. And we ended up doing even a 10-minute version in sepia for United Airlines. But most importantly, I want you to understand, I actually did do commercials wearing clothes.
東や西のコーヒーに新しくなったクリープが届いています。ニュークリープ。
New creep. This was like really great, and because of light, we shot this commercial every morning from about 5:30 to 7:30 because of the light. But that was really fun stuff, and I want to share with you a couple of other things. Up in the upper right is me for a Fuji film thing, and that's me in the bottom right with my girlfriend who was Miss Okinawa. So I had kind of the Don Johnson Miami Vice thing going on there working at. So the reason I'm showing you that is that, man, I had it going on in Tokyo, okay? I had it totally going on in Tokyo. And I mean, you know, you can imagine that my nickname among the casting directors in Japan was, get this is ironic, Man of 1,000 Faces. Because I could play all kinds of characters. I could play what they call dandies, you know, tuxedo guys. I could play, you know, cameramen. I could play, you know, bank guards. I could play all kinds of things. And I think that's really ironic in retrospect. How much fun do you think it is doing commercials like this? All right? And as I became more well-known and versed with the casting directors and stuff, they would let me improvise some stuff in some of these commercials. And I'm not even showing you, I did many, many, many videos. In other words, I'd be driving cars on the beach and that kind of stuff. And what they would do, they would have a Japanese celebrity and they would drive a Nissan on the beach, and I would go to the United States and Canada. I would drive the car on the beach for the rest of the world. So this was the kind of lifestyle I had going on in Japan. And gosh, you know, as I said, it was really fun. Also, as an ironic thing, this is a picture from a catalog. I was the Fujitsu man in 1984 for Australia and New Zealand. So think about that, you know. I'm standing in front of you now. Not only was I Dr. Casa, I was like the Fujitsu man. Fujitsu man has changed, okay? So, you know, when I think back to this, I understand with trans people, and you have to understand this as providers. The overwhelming majority of transgender people don't want to talk about their pre-transition life. In fact, if you call them by their previous name, a lot of the people get incredibly, incredibly upset. I'm very different in that not only do I have no problem talking about my prior life, I'm very proud of how I conducted my life, but that's an exception. So it's called dead naming. That's when you call somebody by their pre-transition name. I think when people do it, generally it's by mistake. Sometimes I think the response is a little bit disingenuous. It's too dramatic, but respectful. People don't want to talk about it. I respect that, okay? So you have to understand that as a provider. That's their choice. That's their decision. That's not your decision, okay? But this is how I see me. This was at a friend's wedding in 1986. And I see this guy as being my twin brother. Okay? And you know, when you transition, especially at an older age, you know, there's a sense of that you're being incredibly selfish, you're being totally self-centered, and you're in a sense killing somebody. That's a lot to handle, okay, among other things that's going on at that point. But for me, I'm okay with this because I see this guy as a twin brother, and that was a different part of me. It doesn't totally define me. It's part of me, but it doesn't define me. So I'm okay with that. But a lot of people, unfortunately, are not okay seeing their pre-transition lives. So what happened was, I came back to the States. I was working for a modeling agency in New York called Zoli. That wasn't going anywhere. And I was trying to establish a direct business with Japanese companies, dental business. I was about 6 years ahead of the time. And the problem was I didn't have a strong Japanese connection. So I played around with that for about 14 months, wasn't going anywhere. So then I came to a decision. I'm going to make a deal with the Air Force. I'm going to go back to Asia. And then at the end of my 4 years, I'm going to change gender. This was 1987. So what happened is I went back, I was chief of pros at Osan Air Base in Korea. And I was head of the dental lab for all the Pacific. But what's the change here that you notice immediately? No mustache, okay? And that was my moniker. So I went back and I was in Korea and I had fun. It was like living in a commercial. I mean, we're always like in combat readiness, and we worked 10 hours a day, 6 days a week. But I had a chance to take a lot of pictures and do a lot of flying. And that's my first selfie in the back of an F-4 fighter plane. So I concentrated on my dentistry. That was really good. And I just played around a little bit, took a little bit of estrogen, because you could buy estrogen off the street or off in the stores in Korea. Wanted to see how that was going to make me feel. Didn't make me feel one way or the other, but it kind of mentally kind of made me feel a little bit uncomfortable, probably like a placebo thing. So I left there, went to Japan, and then I ended up, well, this is me leaving. And you can see this is basically what I'm doing. And as I said yesterday, you know, patients are so funny. They think nitrous oxide is there for their use, but of course it's there for the provider's enjoyment. No, don't send me letters. That wasn't a Friday night at Old San Airplane Base. That was just on the tanks. Okay. So that's your typical Air Force medical officer. So I went back to Japan, then I worked my way back to McGuire Air Force Base in New Jersey, where I was chief of pros. I got held over because of Desert Storm, all right? And so at this point, as I was completing my Air Force requirement, I came up to the fork in the road. It's like Yogi Berra says, right? He came to the fork in the road, take the fork. I had a decision that had come to my mind how I was going to do this. I was going to either transition gender, right? And I knew that people would do the surgeries, and then go to medical school. Because I thought the response in dentistry would be so negative that I'd have a tough time, that if I'm going to transition gender, I better go to medical school. That was one option. And the other option is, and I can't make this up, I love endodontics. Even doing pros, I did a lot of endodontics on both two-legged animals and four-legged animals. So I really wanted to specialize in endodontics. So I came to this conclusion that the only way I could do this fairly and let fate show her hand is if I only apply to one endodontic program. So I chose the most difficult to get into, the one that I thought was the best, which happened to be the University of Pennsylvania, and fate would show its hand. So if I was meant to be an endodontist, I'd be accepted. If it wasn't, I'm going to change gender and go to med school. So I applied and I got accepted, and off I went. But the fact that I'm standing here in front of you today as Ann Koch, things didn't quite work out exactly according to plan, okay? So what I ended up doing was I left the Air Force on a Friday before Labor Day weekend. You can see how slender I am. So I left on Friday and I began my endodontic program on Tuesday, back here at Penn. So this is me working with people. And then when I left the program, I went up in 1993 to Harvard. And I had this kind of Michael J. Fox look going on, right? It was like Michael J. Fox, okay? So I had this Michael J. Fox thing. I go on, and then what happened, I was able to create my own postdoctoral program at a terrific institution. So I was able to institute all my concepts I have about endo-restorative and the continuum. They're not separate entities, they're a continuum. So I was able to put all that together, and I did that for a number of years, averaged 80 hours a week at the school. So I loved working with the residents, that's why you do that. And then it came time for me to take it more into the business area. So I left that, I went out to Tulsa for a couple of years, as I said to you earlier. That was my MBA. Then I set up Real World Endo, and then I started lecturing all over the world. Again, great success in terms of a following, great success in terms of products and techniques being adapted. So everything was going great. You have to understand for transgender individuals at this point with marriages and relationships, it's totally platonic. And you know, it's really difficult from a woman's perspective, how come they hang in there? But the reason that they hang in there is not just because they think they're going to change. There's not a lot of other options, okay? My wife was, and is a Japanese individual. So we had a beautiful home on the end of Long Island and a beautiful home down in Palm Beach. So she had a great life. So why is she going to blow it up? Because maybe she's not having the intimate relationship that maybe some marriages have. So you go on autopilot. You know, I was doing something I love. I love teaching. I like lecturing, obviously. I was making more money than I could ever have imagined. I liked fishing. I had a great boat. So all these things were happening. But it never goes away. And as I said to you guys earlier, 2 times a year I would dress, you know, Christmas and Thanksgiving. And what I would do everything. I would do all the decorating. I would do all the cooking. I would make the menu. I was like Martha Stewart. And as I said to people, I'm not like a transsexual Martha Stewart. I am the transsexual Martha Stewart, okay? So twice a year. So I'm managing it. Everything seems to be okay. And then the trigger event happens. And this is very common about a trigger event. This was the CBA, and this was my last lecture as Ken. So all this came to an end with the diagnosis of squamous cell cancer. Okay? So in May of 2011, I was diagnosed with a squamous cell on the back of my hand. Now, understand that dermatologically, we had either melanomas or non-melanomas. And yes, a squamous cell carcinoma as a dermatological cancer can metastasize theoretically, but generally it doesn't unless it's a severely compromised, immunocompromised patient. And I was not immunocompromised. But just the term squamous cell carcinoma for me as an endodontist hit home. And the truth is, you're kind of almost like looking for a trigger event. So what happened when I got hit with that term, mortality hit me like a ton of bricks. I have to change before I die. I have to change gender before I pass on. So what happened is that between May and October, I purposely lost 65 pounds. Okay? Running, cut out the alcohol, cut out the big carbs. And I had gone on autopilot. I had gained weight. And you can see right here, this was 2 weeks before that diagnosis. I got a nice striped bass there on light line, fat face on the striped bass, fat face on the fisherman. So I was just cruising on autopilot, okay? But then I put things into gear, lost the weight, and then I made a decision. And the decision I made was to go see a plastic surgeon. When I was at Penn and at Harvard, I used to spend Sundays in the medical school library. I would spend 6 hours reading everything I could read on gender identity disorder. I never want to see another archives of sexual behavior in my life. I had all of these little red books. I read through all of them. So I knew what the diagnosis was. I did not need to go see a therapist or a psychiatrist or a primary care person. That's the way people should see it. I had been dealing with this for years and years. I knew what was going on. So for me personally, I had a goal. I wanted to be seen as a professional woman at a University of Pennsylvania alumni function. I didn't want to be seen as a clown or a buffoon. That's just my opinion. People have other opinions. So I wanted to see if there was any way I could possibly pass as a woman. So I made the appointment with a very good plastic surgeon, like the best in Boston, Jeff Spiegel. So Jeff practices, he's the head of otolaryngology at BU, and he practices in Chestnut Hill, which is a bed town right outside of Boston. So it took enormous courage to call in and make the appointment. And then I had to prepare for the trip. So I was going to take a ferry across Long Island to New England and drive up. So for the first time in my life, I went to a hair salon and had my hair done in kind of a little bit of a feminine, kind of androgynous way. And for the first time ever, I had a manicure. I had nail polish put on my nails. And as I mentioned yesterday, the color I chose, ladies, was Lincoln Park After Dark. Is that a fabulous color? Right? That's like a fabulous color. So I have this, and I got the outfit. And of course, what you had to do in those days, you had to plan your trip around the bathroom. So I had to plan, like in the Connecticut Turnpike, where can I go if I have to go like pee, okay? It's like so absurd. So I do this whole thing. I've got gloves in the winter. I can get on the ferry boat. And it was a ferry boat where after you pay, you can stay in your car down below. Thank God. So I'm there, get in the car. I drive up to Chestnut Hill. I get a little bit lost, but it's okay. I find my way to the Marriott, and I had planned everything. It's a Thursday night in November. What I'm going to do, ladies, I'm going to sneak in. No one's going to see me. I'm going to register and go to my room. There's only one mistake to that plan. I didn't realize it was the Boston College Notre Dame football game. So I walk in, there's 500 young men and women in the Marriott having this party. So I'm so happy I didn't chicken out and turn around and walk out. So I walked up to the desk, the registration desk. I had to take off my gloves. And this was like mortifying to see this, painted nails. And I decided, I know what I'm going to do. I'm going to trick the guy behind the desk. I'm going to make him think I'm Gothic, right? Right? So I tried to make some kind of lame ass excuse about being Gothic. He didn't buy that, but more importantly, I realized he couldn't care less. He couldn't care less. So I register in, go to the elevator, go up to my room, I collapse in my room, okay? So the next morning I wake up, I'm ready to head out to Jeff's office, and I looked at my suitcase. And I had packed three types of attire. One was a pair of chinos, Ralph Lauren chinos, button-down shirt with a sweater. That's typical guy garb. Guys, you have no idea how easy it is to get dressed as a guy, right? Then I had a completely androgynous outfit. I have no idea how I put it together. That was there. But the third outfit was a beautiful woman's cashmere sweater with a pair of really nice black wool slacks and 2-inch heels. So I remember looking in the suitcase thinking that if you don't get out of the suitcase, I never thought about the closet, but if you don't get out of the suitcase, it's never going to happen. So I ended up going for the slacks and the heels, and I walked out of the room, and it's like one of these cheesy Rod McEwen poems where you see this golden stairway going to the heaven when you die. There was like this aura. When I first walked out, it was like, kind of caught me by surprise. I realized it was all my imagination, but, composed myself, right? I checked out from the room, and I remember walking across the parking lot to my car, hearing my heels click. And I remember thinking like, oh my God, that sounds like a woman, right? So I go to my car, get in the car, drive over to Chestnut Hill, Jeff's office. I go in, I have to take off my jacket and my gloves, and immediately his front desk girl compliments me on my nail color. So I'm thinking, oh my God, this is great, we're off to a good start. So then I'm sitting there, and then another beautiful young woman comes out. She says, follow me, please. And she takes me into a room. So we go into a room, and I sit down, and what she does is she walks out of the room, and she closes the door. And that's when the terror sets in, okay? I have a friend who's a surgeon, who's also like myself. She describes it like falling off of a cliff, okay? Being a heterosexual guy, successful in my career, never having gone out of my house, ever dressed as a woman, all of a sudden having this woman go and close the door, panic sets in. Oh my God, they're calling the police. I'm going to get arrested. What was, who am I kidding? Oh my God, this is going to be so embarrassing. There goes how can I do? I feel myself going into syncope. And I realized, oh my God, this is going to be mortifying. And then I realized, oh goodness, this is like a dental chair. It was a dental chair. I could push it back. And I noticed over in the corner of the room, there was a sink with one cup. I don't care what had been in the cup. Could have been like, plutonium. I don't care who had drunk from the cup. I needed to have a glass of water. So I went over, had a glass of water, put the chair back, wiped the sweat off. I sat down, tried to relax, did relax somewhat. And it was about 10 minutes more, which is a long time, before this woman came back in again. So she comes back in, she sits in a stool right in front of me, and she then says to me a couple of nice things about the way I look. I'm sure she says the same thing to every patient, but of course I believe it, right? But that's a nice trick. So then she's in front of me saying this stuff, and then she holds up this paper like this. She goes, we have a problem now. Problem? Problem? She goes, it's the medical history. She goes, this, your name. Because I had put down Ken Koch. She goes to me, she goes, obviously, you've been doing this for years. What's the name that you use? Well, I didn't have the courage to say to her, no, honey, this is the first time I've ever done this in my life, right? I didn't want to seem like a complete rube, so I had to come up with a name real fast. And the name that I came up with was my Irish grandmother. My whole family is German, but tucked in the midst of all these people was that Irish grandmother. And she was very proud of the fact that she was born in the 1800s and she was a high school graduate, okay? She was very proud of being Irish. But what had happened, I was so amazing. This woman, 3 or 4 times when I was like 9 or 10 years old, asked me when we were alone, did I ever think that I really wanted to be a girl? Whatever made this woman get that impression? And that's not unusual. I know a couple of other transsexual women have had the same thing happen with a relative. So this grandmother to me 3 or 4 times asked me, did I ever think I wanted to be a girl? So I figured, oh my God, that's the name, that's the perfect name. And what was her name? Her name was Anne McCormick. And we used to call her, Grandma Annie. So I said to this lady, Kate, Jeff's assistant, I said, well, it's Anne. She goes, Annie. I said, Anne, A-N-N-E or Annie. And you know what? Annie totally works for me. It works for me personality-wise, and more importantly, it's age appropriate. It's not like Brittany or Tiffany, right? Or, wait, I'm sorry, or God forbid, Caitlin? Oh God, right. So I mean, please, get get the paddles out here for Dr. Koch, right? Get the paddles for Dr. So anyway, so all right, so I meet Jeff. Jeff is amazing. Jeff's wife is actually an endodontist, and he never told her, which is amazing. So what I was trying to do at the time, and you have to understand this with older people, I was trying to salvage my life, meaning my relationship with my wife. I was trying to salvage my business, which was a big deal. None of this was working out, and ultimately none of it did work out. But what I wanted to do was try to titrate this change over a period of a year. In retrospect, that was probably a mistake. So what I wanted to do with the first visit was just have some minor work done. So what we decided to have done at the first visit was the following. Have a lower blepharoplasty is a great procedure for men and women where you remove some of the fat underneath the eye. That takes away that hangdog look some people get with the real baggy look. The second thing, the best procedure aesthetically for a mature man or woman is a neck lift. Not a facelift, but a neck lift. Totally changes your profile, takes 10 years off of you easily. And then the third thing is that a lot of trans women have very large heads physically. So cheek implants kind of won't work for that person. But for me, I'm kind of at the max limit. And so I thought pretty good cheeks as a guy. But he suggested like some very small sized malar implants. And I kind of like, shameless here, I kind of like the contoured look a little bit more. So I went for that. So these were the three procedures we agreed on for that first round of facial feminization surgery. I'm sorry, this picture's all redded out. That one's a little bit better. This is me, day 3, back from the hospital. You will notice that I'm kind of puckered on the right side of my lip. That's because that's all paresthetic. When you go in and you place malar implants, you make an incision way back here up in the tuberosity area in the vestibule. Sometimes you nick something, and it takes 5 to 6 weeks for the paresthesia to go away. Right? But you can see I'm not exactly a happy camper at this point. Day 4, now I look like a pumpkin, okay? And you can see here with the Barton's bandage that there's not a lot of fun. And my support system, and this is my fault in retrospect, my support system through this entire thing was a stuffed moose, okay? And I remember lying in the hotel in Boston thinking, what did I ever do to piss off so many people that here I'm doing something so important to me, and my support system is a stuffed moose from Filene's. I don't have an answer for that still, other than the fact that I didn't share my intentions with people in the manner in which I should have. Probably in retrospect, if I was more honest with my intentions, I may have been able to gain some support. But at this point, a couple of people I asked had no interest coming up. So it was me and the moose. Okay? So the next day, day 4, I look like this. And I was in Charlestown up in Boston, which is near the north end, which is where the Italian section is. So I walked over to this Italian coffee shop, which is one of my favorites, Cafe Vittoria. I walked in, I sat down, and this really brassy waitress, you know, with the typical black dress, about 60 years old, comes up to me and she goes, "Honey, you look like you've been in a fight and you lost." So I responded in my most feminine voice, "I'll have a cappuccino and a slice of your fabulous rum cake." Right? That was my response. And there's the cappuccino and the fabulous rum cake. Okay? It is a great cappuccino. So the next time, day 6, now I got a Planet of the Apes look going on. Right? I mean, take a look at this. This is like, you know, where's Charlton Heston? I mean, it looks like, you know, Planet of the Apes. I'm trying to figure out, did I sign up somewhere on the consent form that I wanted to look like a movie star or somebody from the Planet of the Apes? So now take a look at day 7 and 8. Now I look beat up, but I look like a beat up woman, okay? So that's pretty amazing at that point. Then 2 weeks later, I'm back at my house in Long Island. I've kind of got this Edie Brickell bohemian thing going on, right? Right? Then 3 weeks from that, 5 weeks from the beginning, I look at this, it's like, oh my God, I've become my mother. And actually, Jeff shows that picture, and when you see it without washed out with the color, it's actually a really nice picture. But my mother had been a singer for NBC, That's where the projection of my voice comes from. Okay, so blame it on my mother, right? So she had been a singer, and she had a picture when she was at NBC with her hair up. And it was just a gorgeous picture of her, and it kind of idolized it. So when I saw this picture, I realized, oh my gosh, look at this. So that still remains probably my singularly most favorite picture. As a side note, I live on Cape Cod. This is a flannel nightgown. I still have that. All right, so what happens, this is the regimen. Most trans people, male to female, take anywhere from 200 to 400 milligrams of spironolactone as a blocker, as an anti-testosterone regimen. My testosterone level was amazingly so low, the people at Boston Medical Center said, we can't believe you pulled off being a guy so successfully for so many years. I was actually really very pleased to realize that the testosterone level was so low. So I only needed 100 milligrams. For me, I took 2 milligrams of estradiol, which is estrogen. I did not use the patch. I took it PO. A lot of the studies on clotting have to do with XX women, not XY. But one thing that was really a bonus was I took 5 milligrams of finasteride, which is Propecia, and that really resulted in a lot of hair growth. So I think people working in primary care with older male to female trans people should really think about including 5 milligrams of finasteride. Okay, I went back for round 2. What happened was that after that facial feminization surgery, I had a really interesting response from people. People either thought I looked utterly fabulous or they thought I had cancer or AIDS. And the other thing I found out was that people who knew me were concerned. People who didn't know me thought I looked great. I never got so many compliments as a guy as I did between the time after that first feminization surgery and the second. Because facial feminization surgery doesn't just make you look more feminine, it makes you look younger. Okay? So that was kind of amazing. I mean, it was that response. But that still wasn't enough to have me revert. So I went back for round 2 on election day in 2012. This is what I had done. One cheek implant I rolled. I did a thing called the lip lift. Lip lift is a great procedure. When people get older, the distance from the bottom of the nose to the upper lip is called the philtrum, and that gets longer. And it also looks more masculine. So what a lip lift is, and 99% of cisgendered women don't even know this exists, is you make an incision and you reduce that difference. By reducing that difference, it makes you look younger. You can extrovert the upper lip and give yourself a little bit more lip instead of just pumping in Juvederm or Restylane. It's a really nice, simple aesthetic procedure. I also made it difficult for Jeff Spiegel. I said, I want to look like Ken Koch's sister. I never had a sister. So I didn't want to have this totally blow everything away type of thing. I wanted him to lightly fine-tune things. That takes a lot more tactile awareness and is more time consuming. In retrospect, that's probably a mistake. I thought by having some resemblance to Ken, it would make the transition easier to friends. Just the opposite. It spooked him. It made it really kind of like very strange to him. So if I was doing something in retrospect, I might have gone for a completely different look, okay? Which is kind of an interesting thing. It just did not work out the way I thought it was going to work. So anyway, that's me. Sorry about this greenness here. But I went back for the second procedure, and ladies, that's my own hair, okay? So I had great hair, and if you see the picture on the computer, not here, it's really kind of a cool picture, and I got this Farrah thing going on with my hair, right? 3 days later, I ain't looking so Farrah-like, right? Pretty beat up, gets worse. That's an attractive picture. And then I become a bug. Like, get the raid out of my room here, please, right? So that's it. Then, of course, we all know from dental surgery, when you're grinding on bone, especially as an endodontist, all of a sudden the edema comes along. And amazingly, this is not as painful as it looks, all right? It's not pleasant. It's not a walk in the park, but it's not as painful as you would think. The most pain for me was sitting there by myself. But the way I did it was I kind of made a pact with myself was that I asked for this, so don't complain. So I just sat there and, you know, kind of watch TV, watch videos, listen to some music. Then 3 weeks later, here I am, visiting one of my residents and having fun. Once I got the FFS, and for an older trans woman, having some facial work done, whether it's a simple thing, and the giveaways for trans women, 3 places. Supraorbital bossing, you're getting bossing over the orbital rims here, rhinoplasty, and cracothyroid, an Adam's apple. I never had an Adam's apple, so that didn't matter. I had very little bossing up here, not unlike a female athlete, so I had nothing done with my forehead, scalp, or my neck. I had a rhinoplasty done, even though I thought I had a pretty good nose as a guy. I just wanted it a little bit more slender and a little bit more youthful. But the 3 markers are forehead, nose, and cracothyroid for trans women. I then was able to get an appointment, a cancellation for gender confirmation surgery. So this is me on March 25th, about 6 o'clock in the morning in front of a hospital. This is the last picture of me as Ken. This is surrealistic. When you're doing this is like surrealistic, having such a dramatic change. And this, I had to get an escort. I couldn't get anybody, so I said to my ex-wife, I said, you have to show up. You're getting lots and lots of money in the divorce settlement. You need to get your rear end here, okay? So she showed up, okay? But it's really a terrible situation for a spouse. So the procedure's done. Here's me immediately post-op, and it took 2 hours and 20 minutes. Now, normally it takes 4.5 hours, but this individual did it in like 2 hours and 20 minutes. I've had endodontic residents take longer with apicoectomies, okay? So I couldn't believe how fast. But there's another thing here that's kind of my personality. Before I had this procedure done, I'm thinking, you may be near death if something goes wrong. I may be near death, but I don't want to look like I'm near death. So I had my eyebrows and eyelashes tinted. Right? So I think that's kind of serene. You can't move for 3 days. That's terrible. You're on your back like a tortoise. The surgical site itself doesn't hurt, but where they suture into your thighs and buttocks to keep the stent, that starts to really hurt. And I told you guys the story earlier about my spouse in a blanket. So by day 6 or 7, it's pretty sore. So your first follow-up when you go back to the surgeon, and it's usually the physician's assistant or the NP, usually the PA, they take off the dressing. It's amazing that you don't pass out. Because when you look down and you're not seeing a beautiful female genitalia, you're not seeing any remnants of male genitalia, all you're seeing is a huge hole. It's like you stepped on a landmine. And so it's like, what in the world did I do? And I'm sure every surgeon goes through this with their patients. So not only is that a shock, then you're introduced to the art, euphemistically said, of dilating. These are hard plastic rods that you have to dilate with, because if you don't dilate, the vagina is going to close up. Okay? So let me talk about that. What's the regimen? The regimen for the first 6 months post-surgery is 5 times a day for a half an hour each session. Okay? So let me talk about something. With this push about having surgery in young kids, there's this thinking for a while, let's have a surgery between high school graduation and when you start freshman year in college. That's a huge mistake, because how many young girls as a freshman in college have the time and the privacy to dilate 5 times a day for a half an hour? 0. So if a person's going to do that after high school, they need to take a gap year off and properly heal. If you don't dilate, it closes down its stenosis, and any surgical attempts to go back and regain length is really, really a difficult challenge. So the dilation is a critical thing. And how long do you dilate? The rest of your life. Okay? And this is a problem, because people don't understand how important this is. I also talked yesterday about with this introduction of all these cisgendered surgeons now doing gender confirmation surgery, they've brought to the forefront pelvic physical therapy. And we have a physical therapist with us in the audience, and we talked last night. This is a great thing. This can be a huge help in terms of maintaining the health of the neovagina post-operatively. So this is a big deal. You have to dilate it. If you don't use it, you will lose it. In terms of augmentation, Let me tell you the truth here about estrogen with male to female trans people. The house rule has always been with young people, you'll develop breasts 1 cup size smaller than your mother. That stops about age 45, certainly by age 50. Anybody over age 50, when you take estrogen, even with a blocker, the breast development that you get is very tubular. They look like Japanese sweet potatoes, right? They really have, there's these tubular things, and even with ptosis. So what happens is that you're going to end up having an augmentation procedure. And with aug procedures, you can go under the muscle or on top of the muscle. Most of them are done under the muscle. I had mine on top of the muscle because I didn't have a lot of breast tissue. And I also had, I do a lot of athletics. But I was really an exception because when I went in for the consult, I did something very unusual. I requested the smallest size possible. Okay? Listen, I worked as a model. I play a lot of athletics. I've seen lots of women with small breasts. The other thing for me is I like fashion. And, you know, XY women are much bigger in the shoulder and the neck than natal women. So if you have that kind of shoulder development and a larger chest and you stick 850 Mentor implants on it, honey, you are never buying off the rack. Okay? So you're going to be, it's just the truth. You are obligated to a life of formless shaped outfits. Okay? For some people, that doesn't matter. Okay, fine. But for me, this was part of the whole thing of being a woman and acting like a woman, dressing, being a professional. So for me, I went for the smallest size possible and had no discomfort, took 1 towel. So that's me 3 days later with a sports bra, which you wear for like, 10 days and doing okay. 2 years, not 2 years, a couple of months later, back on Cape Cod, things look pretty good in terms of a surgical result. And then 2 years later, on my way to the pool in Hawaii, and I'm shaved, this got totally redded out. I had a friend take that picture, and if you saw the real picture without all this discoloration, it's a nice picture. And you know what? It looks pretty good. Looks good for somebody 65, especially an ex-quarterback. So that's the current version of Ann Koch, okay? So, you guys are too kind. You are way too kind. I want you to read this. This is a lady who's a therapist who actually is a hockey mom. And she's retired now, but I think she was really one of the best therapists. And she sent me this in an email, nothing purposely for a quote. You can read this as well as I can, but the thing I want you to understand and concentrate on is the following. The main thing they all share is the struggle to be authentic, to be known, to be heard and received. That's a huge thing with trans people, trans guys, trans women, young, old. It's an incredible struggle to be seen to yourself as being authentic and to be known and to be heard and to be received. There's really a lot of wisdom in this quote by Maureen. So let's talk about the patients. In terms of the barriers to healthcare, again, you've heard me say this multiple times, and you heard Brad. The personal humiliation stories, it's stunning to me. Like, how can this happen in this country? These people have just hideous stories of being treated in a manner that we can't imagine in the healthcare industry. Secondly, a lot of them just get summarily dismissed. Oh, no, that's specialty work. That's such a cop-out, okay? Again, primary care is the area where we really need the most education. It's on primary care and therapists. Lack of trained medical personnel, that's why I'm here. This is changing as we go forward. And within 4 years, most of this care will be delivered through academic medical centers. Another problem is that people don't really adequately talk about or honestly talk about is that the unemployment rate with transgender individuals is off the charts. It's not 24%, it's a heck of a lot more than that. And so if you don't have a job, you have no access to health insurance. So it's like a vicious cycle. So these are among the most pronounced of the barriers to healthcare for these patients. Again, we talked about earlier the whole thing about pronouns. That's not your decision. That's their decision. He, him, she, her, ze, they. See now in a lot of universities with emails, Bob Kane, he, him, Ann Koch, she, hers, Ty, Z, they. That's their choice, so respect it. And again, the easiest way to work with these people is that you ask them. In terms of creating a welcoming environment, that gets back to your question about when they first come in terms of medical history, systemic things, whatever. The first thing is, before they even get to you, is having that clinic or that office create a welcoming environment. No brainer, it's obvious about having forms that reflect diverse gender identities. So again, should not just be male and female, right? And it's not going to be male or female, none of the above. As I said to you, male, female, gender non-conforming, or non-binary. You don't have to have 12 different gender things that Google has. All you really need to have is 3, at the most 4. 3 will work. The whole bathroom thing, that's been so worked over and over. And it's such a simple thing, having a gender neutral restroom. The question goes away. If nothing else from this entire day, what I want you to take away is ask patients how they prefer to be addressed, okay? This is both in person and on the medical history form. And I'll give you an example. I don't think I said this to the group. Did I tell you about my experience at Boston Medical Center? Let me tell you about this. I was lucky through Jeff Spiegel that when I saw a primary care person, it was the lady who ran women's primary health clinic at Boston Medical Center. She was also just starting the trans program. So I'm sitting there one day and I look just like I am here, maybe 12 pounds thinner. Okay, I was quite slender. So I'm there with 5 other women and this tech comes out and has my name and she goes, Ken Koch. I don't move. I don't make any motion. So then she goes, Ken Koch. I don't move. So then what does she do? Bellows out my name, Ken Koch. So I raised my hand. I said, excuse me, over here. I said, come here, please. And I said to her, I said, the first thing for you, it's Dr. Koch. Okay? Right? Right? So then I said to her, I said, what I want you to do is I want you to write my name on the front of the chart, Ann Koch. She goes, I can't do that. I said, yes, you can. Because it's not what it says on your insurance card. I said, that's being changed. Write my name on the front of the chart, Ann Koch. She goes, I can't do that. I said, yes, you can. I said, okay, let's ask Dr. Siegel. She's the primary care doc, runs the whole clinic. Walked in to see Jenny. What's the first thing she says? Of course, write the name on the chart. And I ended up speaking to the entire staff at Boston Medical Center. I mean, just yelling it out louder and louder is not the way you handle this. Furthermore, you have to understand here is it can't be totally dictated by certain protocols. This is a sensible thing. Here's a person who looks like a woman and wants to write the name in pencil on the chart. Write the name on the chart, okay? So that's how we solve that issue. But again, it's one of these things where, again, both in person and on medical forms, how they want to be addressed and do not assume anything. This is where interactions with trans people go off the table. Oh, how's your husband doing? That's not my husband, that's my wife, okay? Or how's this or how that? Don't assume anything. That's going to be a little tricky if you've never done it before. Just be polite. But don't make any assumption that that's a man, that's a woman that prefers to be addressed as a woman or a man, that's a spouse, you don't know. So you have to be a little bit careful with that group. Respect that their frequency is a little bit different maybe than yours. Just treat it with respect. If you have any question, ask them politely and they will be incredibly thankful that you did it that manner. Okay, hormones, medical history. Yes, you can ask people about hormones. But the whole thing is don't immediately take that into like, are you going to have the surgery? That actually, honestly, is none of your business. Okay? Or did you have the surgery? That's none of your business. If they want to share that with you, they'll share that with you. Most likely they won't. Okay? So you just get that information. And then the other thing is, it's so easy for people who want to be supportive, who are very well-intentioned, to get overzealous. And they start asking all kinds of questions. Don't pepper these people with questions. And the other thing is I say to transgender people, I'm speaking to a lot of different support groups of people, give the providers a break, okay? They're trying to be supportive. They're not trying to create problems with you. Don't fly off the handle. And this other thing about, well, they're gatekeepers. Wait a second, time out here. There's a difference between a, quote, gatekeeper and somebody who just wants to be thorough. And they want to be thorough because they're concerned about your health. That's the conversation I have with transgender people, okay? So it goes both ways, okay? You guys are trying to be totally professional supportive. They've got to understand that you're trying to be supportive. Give them a break. So that's how this thing has to be handled. Handled professionally with some tolerance and understanding, not by a political agenda. Okay, let's talk about testosterone. Testosterone is so much stronger a hormone than estrogen. You get changes immediately that are permanent. For instance, the voice deepens. Estrogen does not change your voice. In fact, after I transitioned, I loved lecturing as a guy. I spent a year on the trans circuit going around with Jeff Spiegel. Jeff would talk about the surgical procedures. I would talk about kind of the anti-show, and I would talk about maintenance, Juvederm, Botox, Restylane, blah, blah, blah. But I would practice speaking. And as a guy, I would speak, and if I wanted to emphasize something, I would use the old Irish politician's trick of repeating it and repeating it louder. The number 18 spreader. Let me repeat, a number 18 spreader. But as a woman, I realized I could have the same effect by moving my voice to the front of my mouth. And it worked the same way when I'm lecturing, okay? So for me, it was a great example, but estrogen does not change your voice. Testosterone dramatically changes your voice. And that change is permanent. So if somebody is transitioning for a year and they're taking testosterone and then they detransition, they're still going to have a deep voice, okay? Increased growth hair. Oh my God, the hair, increased body hair on trans guys from testosterone is stunning, how heavy it is. These guys will also develop male pattern baldness. And there will be, with long-term use, an increase in the size of the clitoris, but it's not functional. It's really basically like a micro penis, okay? Some things that are not permanent, menstrual period stop. This is case by case. Muscle mass, yes, that'll increase, but can also go away when you stop taking testosterone. And you see some of the other things. One of the quick things that you see with trans guys when they first start taking testosterone is red facial flushing. Not to mention there's really some different skin changes, a little bit more of a greasiness, a little bit more acne. In terms of emotions, trans guys generally come in with relationships. And the relationships persist very, very well with trans guys. Trans guys transition at a much younger age than trans women generally. Where a relationship has faltered, it's generally because the individual transitioning has developed a much more aggressive personality. Testosterone is really, really a tough drug, okay? And that's what alarms a lot of us involved in this space with this craziness about so many young girls taking testosterone. And they talk about it on the internet like, you gotta get on T. You gotta get on T. Like, huh? There's nothing wrong with being a young woman who's a little butch and who likes sports and maybe likes girls. There's nothing absolutely wrong with that, okay? That's the story that's gotta be told. In terms of estrogen therapy, we talked about breast development, loss of muscle, decreased strength, that's a big deal. I probably lost between 60 to 80% of my strength. I mean, sometimes even the peanut butter jar can be a challenge. But what I did not really lose much of, and it helps me athletically, and it's a very much an unfair advantage, is stamina. I play competitive tennis, and I play with women who had played in college, and I'll play 3 sets. After 3 sets, you can stick a fork in them and they're done. I can play 5 sets. I can lecture all day. So the stamina, no one's looking at the stamina associated with a Y chromosome. That has, to me, effects, and it has to be addressed at the Olympic level in terms of who can participate. I'm all for trans inclusivity, but at the Olympic level, I think if you want to compete as a woman, you have to have genitalia to match a woman. Renee Richards felt that way. I felt that way. And I've done it because I play a lot of athletics. I play athletics as a woman, I kind of look like a woman. I play tennis like a professional woman, not like a guy. But I see too many people now coming into the space. They act like a guy, they work like a guy, they win. And I think that's unfair to women. I don't want to have any advances in transgender lifestyle that's at the expense of women. Because as I've said to you many times, transitioning to me, I'm stunned at how much more difficult it is for me as a woman getting things done as it was to me as a woman, as it was to me as an old white guy getting things done. So I'm all for you, ladies, and so that's where I'm coming from. True. Yes. That's a big deal for me. That's probably my sweet spot, living the dream. I've become a mentor for a lot of young women, 34 to 41, physicians and dentists. And especially now, you know, in medicine dentistry, you have so many young women coming from, you know, the Middle East, coming from India, from Asia. And generally these women are petite and they kind of stick to me like Velcro. And I love it because I will stand in front of the gun, trust me, okay? Some of the effects on estrogen, increased risk of blood clots, that's mainly with XX women. With trans women, that's not quite as noticeable. Surgical options, real quickly here, a couple of things for trans guys. What they generally have is a double mastectomy. And double mastectomies can be done two ways. One is a keyhole procedure. That's only for people with A cup tissue or smaller, so not too many. Generally, what the surgeon does is a double incision technique. One incision inframammary, one high up in the pecs. They punch out the areolar complex and the nipple. They remove the breast, and they punch graft back on the areolar complex and the nipple after reshaping it and putting it higher up on the chest wall. Men have that complex higher on the chest wall as compared to women. Now, there are some great young surgeons like Dr. Keith at Rutgers, when they're doing augmentation procedures on trans women, they're lowering the areolar complex, putting it in the natal woman's position. Prior to this, they were just doing augmentation like for a woman. It's different. Again, this is what these new generation of surgeon is bringing to the dance. They're actually bringing, not just being cash driven, they're being driven by patient care. It's incredibly exciting and it's wonderful. They're using robotics, laparoscopic procedures. They're just doing great, great stuff. Metoidioplasty, that's down below. What a metoidioplasty is with prolonged use of testosterone, you will get an enlarged clitoris. And the surgeon goes in and they sever the ligament. The ligament is chordae clitoris. And by severing that ligament, it frees up the clitoris so that hopefully that individual will be able to stand up while urinating. There's one problem. To extend the urethral lengthening goes into a procedure called the ring metoidioplasty. That has about a 60% complication rate. It's very difficult extending the urethral tissue. Laminar flow of liquid is very difficult. A lot of these people, unfortunately, when they void, end up going through the base of the phallus. It doesn't go all the way through the phallus. I know two surgeons, very high profile people, they stopped doing metoidioplasties, but they won't say it publicly. What's worse is a phalloplasty. Phalloplasty is taken from the radial forearm, this huge scar. Most people have it tattooed later. And what they do is they're creating a penis. The problem is, again, not just the aesthetics, it's the urethral lengthening. It's much easier taking something that's an outie and making it innie than taking something that's an innie making an outie. This procedure has about an 80% complication rate, about $130,000. And even if you go back having the complications addressed over 2 years, at the end of the day, it still doesn't work like the natural item, okay? But medicine has to find, they have to find better solutions for transgender men below the waist. That's why 1.1% of trans guys have anything done below the waist because the procedures are so terrible. It's very different from male to female. Augmentation is straightforward. Genital reconstruction can be actually incredibly stunning how realistic it can be. And you can fool straight men, okay? I don't know if it's wise fooling straight men. I wouldn't recommend that, but the result surgically is that good. There's an interesting expression in the trans community. Trans guys look great on the street. Trans women look great between the sheets. And the best thing I can say is that what has happened, vaginoplasty used to be a two-stage procedure, which makes all the sense in the world. Because the body remodels. You're redoing a lot of the plumbing and wiring. Then there were a couple of surgeons who were driven, in my opinion, a little bit more by the return on the procedure. They made everything single visit. In my book, I talk about it. It's the same analogy in endodontics. For years, we did cases in 2 visits. Then we started doing cases in single visits. With a single visit procedure, who's the main beneficiary? Right? It's the surgeon, okay? So, you know, in my career, I probably did 60-40, 60% single visit, 40% in those cases where I wanted, for whatever reason, to do it in 2 visits. Now, as transgender surgery is going through academic centers, people are back doing 2-visit vaginoplasties. All the centers around the world that have done this for years, that's what they do. The first visit is to create function. The second visit is to go in, refine the aesthetics, and address any complications. That's great news. Okay, finishing up here with some of my stuff. My own personal life, how has it worked out here for Ann Koch? Well, that's me playing tennis. That's a big deal in my life. I am so thrilled after walking away from big-time athletics to be back enjoying athletics as a woman. That's living the dream for Ann Koch. I love it. As I said, I play competitively. It's nothing nicer than getting a check after a tournament. That's kind of, I know what a cute guy he is, right? So I like that kind of stuff. This is my nephew and my nephew's son. The family thing with an older trans person is not easy. My original surgeon, I had asked her a question, it was a couple of months later. I said, how long is it before I don't wake up every day thinking, did I make the world's biggest mistake? And she's a woman like myself. And she said in a nanosecond, 4 to 5 years. 4 to 5 years? Never heard that before. She's absolutely right. It does take 4 to 5 years. I've had arguments with some people, transgender nurses at Mayo Clinic. And they said, oh no, it's instantaneous, it's instantaneous. And they were like so crazy. I finally said, I guess it takes longer if you're accomplished. Right? But the point is, it's not easy. There's so many aspects to this that people don't talk about that as you're older, they become very much a forefront issue. Yeah, transitioning at a younger age is infinitely easier, okay? But at an older age, this is something that you just have to be prepared. God bless you. I like this picture because this little guy down on the bottom, that's my nephew's son. He was 10 years old when this picture was taken. And I'm sorry it looks this way because when it's natural, the picture, it's really a nice picture. But this little boy, Kyle, take a look at his hair. So I said to him, hey, Kyle, this is at Christmas time. I said, Kyle, what's going on there with your hair? He's 10 years old and he goes like this, goes, I got some product working. So he's 10 years old and he's got product working in his hair. Okay. That's me on Cape Cod. That's kind of how I live day to day. Do everything I did. This is one of my residents' sons up in Canada. I still like to ski. And this little boy, 10 years old, he skis on the Canadian national team. Oh my God, how can such a small kid ski so fast, right? But this is like, you know, this is William with his auntie, and he's just a wonderful little boy. So I love that picture. This is me, passion still is fishing. I worked my way through school as a rod and reel commercial fisherman out of a place called Montauk on Long Island, not using nets, using rod and reel. So you have to really kind of know what you're doing. This was me back on Cape Cod, and this was me just a couple of weeks ago. So I still like doing that. And I do everything I did before, I still do as a woman. So absolutely. This is a wonderful picture for me. Last summer, I had my 50th high school reunion. 5-0. Now let me tell you about high school reunions. 10th high school reunion is depressing, right? Because you go back and some of the people in your class are no longer with us. They've died through disease, illness, car accidents. In my case, we had 2 kids in my class killed in Vietnam. So the 10th year reunion is terrible. But at the 50th year reunion, we had 122 people show up And, you know, at the 50th year reunion, we were there because we're just happy to be here, right? So, but they did, all the girls in my class kind of knew the transition. And I have a wonderful friend, her name is Mary. And Mary thought she had the greatest story in the class because she was the class lesbian. So she finally contacted me last summer. She said, I think you've got me beat. So what they did is they took my high school picture and they had a name card and they had my high school picture and then they had Annie. So how nice was that? Went on for 2 days. It had to be one of the greatest 2 days experiences in my entire life, and I've done a lot of things. The guy next to me was the co-captain of the football team, right? I was the quarterback, he was the co-captain. So during the course of this event, he actually asked me to slow dance. So at the end of the slow dance, because he's very comfortable in his masculinity, at the end of the slow dance, he said to me, he said, Annie, I said, what? He goes, I only have one recommendation, one tip. I said, what's that? He goes, you can't lead. So thanks, Gary, okay? So that's how I end my book, is on the reunion. It was really a wonderful time for me. Professional life, it took time. You know, dentistry is more conservative than medicine. This was a mistake I had made. And let me tell you something, that if you have any relatives, this is what you should pass along to them. The first 3 years after transition were, how can I put this properly? Awful. Just simply God awful, okay? Everybody deserted me. All the stuff that I all worked for 60-something years just kind of like blew up. Like, how could this happen? And what changed around my life was getting an email from the University of Pennsylvania. But then I also realized this is about me controlling the narrative. For the only time in my life, I let people dictate things to me. Because I was trying to be respectful. I was kind of lost, confused, dazed, whatever, shell-shocked. Then after 3 years, I took control of the narrative and things changed dramatically. But one of the important things was that it was about 3.5 years, maybe 4 years out, when one of my friends, an endodontist from Long Island, had the courage to reach out to me. It would have been so easy for me to say to this guy, you know, Jerry, where the hell were you when I needed you? Take a hike. I didn't do that. I was thrilled to have Jerry back in my life. So I let him know that I understood totally how complicated, how confusing this is, how thrilled I am to have you back. So Jerry became a friend. 2 weeks later, another guy, Richie from Florida, reached out. And within 6 months, just about everybody came back. So if you have a relative, you have a friend who's thinking of transitioning, you gotta give people time. This is not a cavalier decision by anybody. And what I'm so happy about is that by not jumping to conclusions and having the patience to let these guys come into life, everything's come back. And everything's come back, even including reestablishing myself in my specialty. So that there's something to be gleaned from that, I think, okay? Anyway, this guy, Arthur, and I'm sorry these are destroyed, this image. I went to school with Arthur for many years. He's from Boston, went to Penn with me. So I saw him at a Boston dental meeting a few years ago. It was at the Four Seasons. So I walk up to him, I said, hi, Arthur. He looks at me and goes, hi. I realized he had no idea who I was. So I said, you know me? And he goes, I do. And I said, duh, Dr. Koch. And he goes, I got it. You're Ken Koch's wife. So I said, not really, not exactly. So that was fun, and he did great with it. But one of the things here is that it's about, I don't lead my life as a transgender anything. I lead my life as a woman. But not everybody chooses to do that, and it's okay. I've seen a lot of trans people, they don't want to become a woman. They have their own idea of what they want to be. That's perfectly fine. But for me, my goal here was to be seen as a professional woman. This rocks my boat. This was a AAE, 6 of the 8 Penn residents, 6 beautiful ladies, 6 different countries: Russia, Taiwan, Ukraine, New York, China, India, and I'm the old blonde in the middle, right? But it's fun, and that really makes it all worthwhile. Somebody asked me the other day about something about a tuxedo. I'm totally comfortable, and I'll tell you what I mean. I have a graphic artist. I would never have a graphic artist unless he was a gay man. That's just my own personal feeling, right? And my graphic artist, Ben, is just an incredible guy. So a couple of years ago, I said to him, I said, Ben, I want to make a statement at this function in New Orleans. He said, why don't you wear a men's tuxedo? So what I got is I got a man's tuxedo, had it tailored, blinged out some jewelry with new heels, and I really rocked it. The reason I'm in a pedicab, this is 1:30 in the morning and my feet were killing me. But I'm very comfortable wearing a tuxedo like that and having a cut to fit a woman. So I'm very comfortable with the gender thing. Go over to China. They just were worried about if I treat them nice. I speak at a lot of medical schools. I'm really honored because I got great relationships. This happens to be Tufts. And as I said yesterday, Tufts Medical School has kind of adopted me as a mascot or a spirit animal. And that works for me, okay? Again, this is the University of Louisville. This is at the LGBT thing. Tracy runs the LGBT program. The other individual is a med student down there. So it's all fun stuff for me going around. And this is me at the Ann Koch room. I'm really a big believer in giving back. And I'm really happy that I've been able to donate at the level that I have to the University of Pennsylvania, the second biggest room in the entire dental complex. And it's the Ann Koch room. You can see it says a place to call our own. But there's another inscription on the inside of this room, and it's a big double lecture seminar room. And what that inscription says is that this room has been gifted in recognition of LGBT students, residents, faculty, and staff. Okay? That's the way it should be. Thank you. And this is me in the overseas. As I mentioned a couple of times, but it was just so funny. When I showed this picture to my ex-wife last year, she said to me, it was so cute. She goes, "Oh my God, Annie," she's like, "you look like a rich, powerful woman." Excuse me. That's what we were trying for. So this is the guy with the startup, Nick, having some fun. This is the entrepreneurial thing you saw. So this is the book. And the book is coming out in May. And I'm going to promote this completely immodestly because this book, I'm right down the middle. I say in the preface, I don't represent the far right-wing agenda, nor do I represent the far left. I'm looking for veracity. I'm looking for the truth. But now at the point where we've gotten people's attention in transgender medicine, we now need to get it right. And I always finish any transgender story with this picture. Penn had reached out to me at the lowest of lowest, deepest depths, and went down there. They had an Ann Koch day for 2 days at the school back in the end of 15. And we had a dinner. And we had about 60 to 70 LGBTQI, other consonants, so many consonants now. All these young men and women, just great people came. We had a nice dinner. And then we're leaving, and like 2/3 of them left. I said, "Oh my God, I need to have a picture here." So we had this picture taken, and it sits on my mantle at home in Cape Cod. And you can come up later and take a look at the computer what it looks like. But what I want you to do, even with the color being off, I want you to look at this picture and look at the heterogeneity of this group. There's a lot of different looking people here. Look at the diversity of this group. There are LGBTQA extraterrestrials, everybody in this picture, right? But more importantly, more than anything else, when you look at this picture, what I want you to do is I want you to look at this picture and I want you to think of the humanity. Thank you very much.
We're going to take some questions for the next 10 minutes. Following that, we're going to take a short break, and then we will come back for our endo lecture to wrap it up. So if there's any questions, I'm going to go on the mic with this side, and Dr. Henson is going to go on the other side.
Before anybody else has a question, what is this?
Oh.
In all the pictures.
Right, all those pictures, okay. Having lived in Japan, it's very common in Japanese and now in other parts of Asia, when they take pictures, they do the high V, all right? And so I just do that as kind of fun thing. And you know, it catches on because what happens with a lot of the people is, especially with so many Asian individuals now in medical and dental schools, they know the high V. And it's just kind of like kind of my signal, my sign that Annie's been there. Because that's it. It's not peace. It's nothing having to do with peace. It's just like, you know, that. So questions? Any questions on anything I talked about? Yes, up in the back. especially with like when it comes with celebrities in Japan, they always are like, you know. Yes.
Hi, Annie. Thank you for everything that you shared with us today and being here. I just had a question. So on a recent rotation I finished from, they had a medical database for all of the providers, whether it be like medical, dental, optometry, OBGYN, and they had like a centralized database for their patients so they could like look at their entire medical background. And my question is, do you see the transgender and LGBTY community like going in that direction as far as like a centralized healthcare system? And here at WesternU, like IPE is a big deal and something that we know that healthcare is shifting into. And so do you see your specific community being confident in that?
Yes. Here's what's going to happen. When I talk about success rates, and I talked about having a kind of a depressing success rate, that doesn't mean you stop doing the procedures. How can we improve the clinical success rate? And I talked about, can we improve techniques? Can we improve patient selection? One of the things I mentioned, if we remember, was, do we need a central data collection agency? Absolutely, we need it. Anybody who looks at this through a non-biased perspective realizes we need more facts. We need more evidence. And the point here is that we can no longer get moved off of that by a political agenda. There's no political agenda here. What's done here is patient treatment. So yes, we're going to need to find out what's the sequela. I was stunned when I went through the research doing my book. I do a whole chapter on the future of transgender medicine. So I looked at research, but I looked at real research, and you're looking at a person who ran a program for a number of years at Harvard Dental School, which is part of the med school. I understand how to game research. So when I looked through all these articles, I couldn't believe it. And so I realized, oh my goodness, there are some legitimate articles that people won't even touch, and there's a whole bunch of other consensus-based. Going forward, everybody who's concerned in transgender medicine or surgery, and this wave of young physicians, they're totally on board. It's wonderful. They absolutely recognize the need for evidence-based research, and they're going to basically push forward basically a central data collection agency, because there's no other way that we can do this professionally and sensibly. Does that make sense to you? Absolutely. It's clear. And you know what? It's going to happen quickly, right? It's because in the next, certainly by 4 years from now, but even by 3 years from now, this is going to look entirely different. It's going to be multidisciplinary in approach. It's going to be coming through academic medical centers, and it's going to have all these good things like follow-up and multiple disciplines. Easy to predict. Okay, thank you. Other questions?
Okay, I have a question over here. So Dr. Koch, thank you for being here, by the way, and sharing with us.
Where are you? Just raise your hand so I can see you. Okay, perfect. Okay, great, thank you.
Yeah, so my question is more of a philosophical nature. As far as transitioning hormone therapy, I know a lot of children these days are identifying as the opposite gender.
Yes.
Earlier these days. When do you recommend, or when would you feel would be an appropriate time for a child to undergo hormone therapy or transitioning? I know you alluded to it earlier after high school. So what are your thoughts on that? And do you believe you wish you would have transitioned sooner?
No, actually, that question was broached yesterday. And, you know, it's interesting because the white hot topic in transgender medicine are adolescents and kids. And the epicenter for that, as you probably well know, is Los Angeles. With a couple of individuals in town here. The biggest problem that makes this an issue is that instead of having a legitimate medical discussion, too often it diverts into intense political conversations. You have to put the politics aside. You have to make this patient-based. Here's what's really a challenge to me. I think the young kid and adolescent thing, especially with young girls taking testosterone, is out of control. But here's the problem. For some of these kids, it's a legitimate decision, even with blockers. Now, let me tell you something here about the studies. And of course, the non-medical people who are activists try to refute the studies. You're an airline pilot. You know nothing about medicine and that kind of stuff. If you go into the Dutch have been doing blockers for many, many, many years. That's where Norm Spack at Boston got the idea. He took it from the Netherlands. And then they came here immediately to the West Coast. They found out if kids weren't put on blockers and they had exhibited cross-gender identity, 78 to 80% of them, by the time they went through puberty, reverted back to their biologic sex. They may have become gay men or lesbian women, but they were comfortable with the biologic sex. Once people started blockers, the return to their biologic sex was 0. So to use a phrase by Caesar when he crossed the Rubicon, alia iacta est, which is Latin for the die is cast. When you start blockers as a young kid, you've made an incredible life-changing commitment. So for me, what makes this so challenging, especially for the people on the surgery side as well, there are some 16-year-old kids who actually surgery at that time is the absolutely right call. But there's a whole bunch of other kids where there's other factors involved, including trendiness. Instead of getting, carotid distension, screaming at people or threatening people, what you need to have is an honest discussion. The problem is at transgender medical conferences, anybody who doesn't have a certain attitude and philosophy is banned from speaking. What kind of academic symposium is that? It's laughable, okay? For me, the reason I'm talking about this is that I've seen this on both sides. The other problem is I have medical colleagues who know this just like I do. They're intimidated. They don't want to speak. I understand that because they don't want to be smeared on the internet. They're running practices. What's going to happen here is that professional heads have to come together on this. And what they have to realize is that, yes, in some cases, blockers on kids 11 years old and maybe cross-hormone therapy at 15 and surgery at 16, you know what? For some kids, that's absolutely the proper decision. But for a whole bunch of other kids, it ain't. My concern has been, and the reason I wrote the book and saw how things are being treated, is that my concern is that illegitimacy is overwhelming legitimacy. The explosion of people has been diluting the diagnosis. And the diagnosis is gender dysphoria, okay? And there's been too many things been put under it for people's different agenda. I thought this would change from the bottom up. It's changing from the top down. You have all these incredible women and guys, young men, coming in the surgery side, and they're doing procedures and manners no one could have dreamed about 5 years ago. They're changing the game. But as that starts to filter down, they're looking at nutrition, pelvic physical therapy. They're looking at aftercare, follow-up. Now they're going to work down, they're going to get down to primary care, and they're going to get down to primary care and therapists. The biggest challenge for me in transgender medicine going forward is we have no buy-in by psychiatric medicine. Now, let me tell you what I mean by that. You have therapists, you have licensed social workers, you have psychologists. That's very different than a psychiatrist. Psychiatrist goes to school for a lot longer period of time. There's very little buy-in by psychiatric medicine because psychiatric medicine sees gender dysphoria and the desire to change one's gender as nothing more than an emotional response to a traumatic event. So when I speak to psych residents, when I do the Annie show, they say to me, see, you were no different. It's a timeout. You're right. There's always a trigger event, especially with older trans people. Car accident, death of a spouse, cancer diagnosis, that kind of thing. So me, I definitely had a trigger response. But that doesn't answer the feelings I was very much aware of when I was 5 years old. So for me, I'm a firm believer that they're going to find that there's a physiologic basis to true gender dysphoria. My concern also is, I'm old enough to see when no lobotomies were done. So I don't want this to go the way of lobotomies. I don't want this to be turned off the way Hopkins did it years ago. They were able to turn off this procedure. So if you wanted to have a gender confirmation surgery, it was like going to a backroom abortionist. This needs credibility, and it needs credibility as a real aspect of the medical school curriculum and to a lesser extent the dental school. But the way that we establish authenticity, nice term, but transgender, and the way we establish credibility is by following the same paradigms that we use in every other aspect. So you can't push bogus research in front of me and say this is real. That's nonsense. It's garbage. So what I'm hoping is that going forward, transgender medicine doesn't become an individual political expedient. It doesn't become a quick way to try to move from assistant to associate by writing a bunch of articles at a consensus base. What I hope is that it goes forward. We get all people, gay, straight, trans, straight allies coming in and establishing protocols in transgender medicine that are solid enough, that are no different than any other aspect. That's how we move forward. I don't know if that answers your question, but that's what it is, okay? Thank you. Other questions? Oh, wait a second, time out, come over here, we'll come over here for a second. What was your name again? Mike. Can we give it up for Mike with all his stuff, huh? Come on, huh? Right here, right here. Couldn't do anything about the color, but he's pretty awesome on everything else. All right, another question. Where's the question? Right over here, okay. Go to Mike.
Yes, I have the mic.
Mike, thank you.
So I kind of understand how we're supposed to treat transgender patients once they're in our chair. But you also mentioned the patient who shaved all their hair and then didn't go to the doctor afterwards. Do you think there should be a more proactive approach into saying that this office is a safe space for these patients? Or do you think that's not really necessary to say, like, I don't know, like, should there be a more proactive approach saying, or like put up a sign saying this is a safe office for you?
I think absolutely the most critical thing in a healthcare environment, in a facility, whether it's a hospital, clinic, office, is having people understand, any patient when they walk through the door, that it's a welcoming environment. That's absolutely the critical thing with these patients. So for me, what it is establishing a welcome environment, because what happens, this is all about having these people get over that initial fear that they're going to be handled and treated in the way they've been treated at other facilities. Again, I'm not exaggerating the way these people have been treated. It's been stunning when you hear the stories. So if you have as much as you can to create that environment, to make them feel relaxed, the more relaxed they are, the better they're going to be as patients, the more informative they are going to be with you, sharing any concerns they may have. So yeah, I have no problem with saying that. Yes. Okay, you saw the Annie show, right? So how are we going to do that? What you need to do is you have somebody write some articles and have it published in local magazines, newspapers. Trust me, I don't know the space, but I guarantee you there's some LGBT newspapers, little columns like that, put it online. You have to have a column, reach out to them. That's being proactive, okay? So like if you have a brand, if you have, you know, the Jonah Kim brand, and you're a great dentist, aesthetic dentist, no one's going to know about Dr. Kim unless you get out there and you push the brand. In this case, what you're doing is you're offering an alternative that you feel confident about. What you need to do is get that information out to the end user. That's what you have to think. Articles in these newspapers, something online, something that's geared to them. That's the best advice for that. Okay. Yes.
Yeah, thank you for being here. So actually, you know, it's a very eye-opening, you know, lecture here today. So I had a kind of like experience related to the transgender patient, like when I was shadowing with a dentist. So after they did all the transgender surgery, so the patient came in, want the dentist to kind of like recontour, reshape their teeth in order to match their facial profile.
Yes.
So at that moment, I just suddenly realized, even the dentist, I think he did, let's say, several cases like this before. But for him, it's still kind of like not very confident or comfortable of doing these because it's a very delicate procedure, let's say. It really needs to work with the patient very like in a personal way to figure out what exactly they're looking for. So my question here is, as dentists, let's say for right now, is currently a lot of like people in this field are developing specific procedures for these patients, you know, because they're looking for a very different treatment. I mean, you wouldn't have other people come in to look for these type of surgery or treatment. So.
I don't completely agree with what you're saying, but let me give you my own experience. I knew that I was going to be transitioning. So what I did, I had a prosthodontic friend of mine change all my anterior crown and bridge. You know what I said to him? I couldn't say to him, Frank, make my anterior teeth more rounded because I'm going to be changing gender. Instead, what I said to Frank was, I said, Frank, could you make my teeth more rounded on the proximal line angles? I want to look more youthful. So what happened was that I had all of my crown and bridge in the front, the prosthodontist, done in a way that was very exactly like a woman. But the way I phrased it to my friend wasn't like I'm going to be changing gender. I want to look more youthful. I think the use of dentistry is so underutilized by transgender people. Women, generally, the proximal line angle is much rounder and not as square. If I was a person and I had undergone this, and I talk about it in my book, if you don't have the resources, go to a dental school. I actually address this in my book because I'm amazed that too many transgender people, like too many people in the public, see dentistry as a luxury. Everybody here should understand dentistry is not a luxury. If anything, it should be seen as part of primary care, okay? So what I talk about is rounding off those proximal line angles and teeth are a little bit more contoured. You can do that with a disc. That's easy peasy. For trans guys, what you're basically doing is making a squarer incisal profile, okay? So in that aspect, that really works. In terms of the dentist feeling awkward, I think you're legitimate 100% right on the money. That then becomes an education issue, okay? And so the dentistry itself is easy. The management of patients is what's going to separate you as a professional. So when I was you, I would really, you know, I'm going to see what happens with this book, but transgender people have made a big mistake not utilizing what dentistry can do for them. Not just in terms of oral health, but in terms of cosmetics, facial features. They're not looking like Sharon Stone, but looking like a woman or maybe looking like a guy. That's what it can be done. So if they're, and I even talk about if they're willing to spend money on plastics procedures, they should be seeing a dentist. So good question. Okay. Yep. Other questions? No questions? No tennis questions? All right.
Oh,
we have we're taking a, oh, I got a question
okay.
over here. Okay, right here. Okay, great. We've got a couple of questions here. We'll finish it up and we'll take a break with this one. Okay. Okay, good.
Hi again.
Yeah.
Okay, so my question is in relation to you were talking about how when you transition, going into business meetings and stuff kind of before, it was really different for you to kind of like present yourself, or like people didn't listen to you as much as before as a man. And so my question is, how do you think, had you decided to transition earlier, how do you think that would have affected your career? Do you think you would still have, you know, the platform that you have now or as successful of a career? And then in addition to that, how can men in dentistry and men in business support women in being confident and coming forward and having a voice at the table?
Okay, first of all, would you like the politically correct answer or the real world answer?
The real answer.
That's what you should have it. Absolutely not. Absolutely not. So for me, having not transitioned allowed me to build not just a personal profile and a reputation, but a very serious company. That was much, much, much easier having the ability to do that as a guy as compared to a woman. As I've said, I was astonished when I transitioned and I went back. Again, it was a double-edged sword. I was very flattered that they treated me like a woman, but I was outraged the way I was being treated as a woman. I think one of the things here that you have to do is a fine edge. And I also realize I'm in a unique position where I have a bit of a status in terms of being older and having a bit of a reputation and some resources. I can act in a certain way. So when I'm talking about that, I'm not thinking of myself personally. I'm thinking about you people as young providers. And I'm thinking of Dr. Gallagher, because she really had to fight it tooth and nail in Indiana. First of all, what you have to have here is you really have to have confidence. The other thing that really helps is you have to get an ally, okay? Doesn't matter if you're a guy trying to get forward or a woman, you have to have somebody who's going to be an ally for your cause. Just try to get to the top, and a solo act is really difficult to do. So if you have a guy who buys into your vibe and is a good friend, and I'm not talking about inappropriate, I'm talking about really thinks you're terrific, he thinks you're a great practitioner, thinks you've got good ideas, they're going to support you. That's critical. because that gives you a lot of credence with the other guys and the other people in the room. So for me, the first thing here is understanding that you're not going to be a rollover. And I've seen that too many times with women. They've rolled over too easily. I'm not in their shoes, so I can't say, well, you shouldn't do that. Everybody's different. But I've spent a lot of time with a lot of really successful women, okay? And as I said, with successful women, they prioritize things. They don't have 15 different things they're trying to do. They have a focus. They're always professional. They're always prepared. And again, one of the things I've realized that they're also good about is they're good about creating a team. One of the great things about a girls' night out, as I mentioned, is that I found that women need to have a good girlfriend. Guys with the testosterone don't necessarily have a great boyfriend. There's too much competition. But I found in my instance, and maybe it's just me, a lot of my girlfriends need to have a girlfriend they can share things with. Someone who's not going to cheat on their husband or their boyfriend or their wife, whatever, but somebody they can confide in, and somebody who acts as a reassurance to them on what they're doing. Business is no different. When you're going forward as a woman, be proud, be confident, bring some of these men along with you. And if there's one that you can really create a great relationship as an ally, that'll work for you. But what you can't do is you just can't let yourself get knocked down 3 pegs. Because one of the things when you get to the business world, it's a little bit more cutthroat. And so again, remember what I said about evaluating everybody. How is she going to be? How can I blow past him? Can I blow past her? I can blow past her. How about Bob? How about Tony? That game goes on all the time, whether you realize it or not. So if you can establish yourself with your abilities, with your confidence, being professional, and let people know in a professional way, not in a way that creates, the bitch word being, thrown all over the place, the B word. You create that and you hold your own, people will respect you for that and they will go forward with you. But what you cannot do is you cannot just let them kick you down. Because once you are susceptible to having that done, they just see that as doing it again and again. It's not just men, but other women as well. That's one thing women I'm amazed about as a woman who used to be a guy. Sometimes women are incredibly mean to other women, okay? Now let me give you an example, all right? This is, where's my endodontist friend? Right, okay, so what happened was this was at the AAE in San Francisco. I went over to the Henry Schein booth, and they had a woman come up to me from Long Island, because I recognized the accent, and I start to work with some interest. She totally came up and dismissed me, right? I couldn't believe it. Like, I'm trying to ask some questions, and she's like, what do you kind of like that kind of about it? Like, what are you doing here? You're a woman here. You're not going to buy anything, this and that. I couldn't believe it. So I said to her out of the blue, I want to see your manager. Okay? So she said, what? I said, I want to see your manager. In the meantime, between the manager and her, another woman came by, and she realized, like, uh-oh, I think this lady's like pissed. Okay? So the manager eventually came over. And so what we had 2 women and 2 guys. And so I said, let me see your rotary files. I said, you don't realize, but you're actually selling products that I've created and have the patents on. Let me see these other files. So the first file I take breaks immediately. She goes, that's not really good, is it? I said, no, that's not good. Let me see the second one. I did test, that broke. The 2 guys couldn't get away quick enough, right? So I said to the 2 guys, they didn't ask, I said to them, you can leave. They went away like in a nanosecond. So I'm now there with the 2 women. And then the one woman who was like the assistant manager, she was kind of like, you can leave. So now I'm left with the individual woman. And I said to her, I said, how can you treat me the way that you treated me when I came up to this counter? Okay? How can you as a woman treat another woman in the manner that you treated me? You should be completely ashamed of yourself. And then I said, you have to understand that women coming up to you here are specialists in endodontics, and you have the attitude to treat them like that. That's absolutely not acceptable, and I'm not buying. That's my attitude, okay? And so like at that point, it was like, wow. But the point is women have to be supportive of women, right? I've been at meetings where women ripped into other women. Wait, time out here, okay? So for me, what this is all about, if you're dealing with women, you know how to do that. But when you're at a table with men and women, if you hold your own and you have your confidence You don't have to be like obnoxious. Just be confident in your beliefs. Don't roll over, okay? If you don't roll over, it's going to work for you because what people are going to be, they're going to realize you're serious. And that's what this is about. Are you here for the day? Or are you serious? I'm serious. You can be serious as well.
Dr. Koch, I have a quick question, and I'd like to open it up to the whole audience as well. As you know, we had slightly adjusted the schedule a bit today.
What schedule?
Right. In a good way. I like. No, the free-flowing nature of this, I think, has been one of its strengths, obviously. But, you know, we may have had a couple of people come in, and there's one topic that occurs to me that we haven't maybe touched on quite as much, and that is the idea of supporting LGBTQ healthcare professionals. So we've talked a lot about the patient-doctor relationship, but how about interactions with transgender students, faculty, and staff? And, you know, I'd like to open it up to the room because I would imagine that there are people in the room that have some thoughts about that as well. Maybe people have had individual experiences that they think would have been much better if there was a little bit better understanding. So I think anybody can jump in here, but maybe Dr. Koch, if you kind of share your...
Yeah, I will. One of the things that, you know, I talk about in the book, I went from I had an incredible transition. I went from being a really very successful heterosexual white old guy to becoming a member of a seriously disenfranchised group, meaning transgender women. So that was kind of an eye-opener. Also, I never really spent a tremendous amount of time evaluating LGBT things in medical schools and dental schools. But when I came out and I transitioned and I'm going around, I'm really surprised at the status of LGBT awareness in a lot of schools. In way too many schools, faculty members are afraid because they're afraid that's going to hamper them in their progression in their track, that they're not going to be able to go from assistant to associate or associate to full. I also have met with a lot of students who are worried that if somebody finds out about their orientation, they're not going to get into the residency or the specialty program of their choice. These are issues that I've seen in multiple schools. I think the greatest way that this can be done is that it comes from the top. It comes from the administration, and having the administration share with everybody this awareness that it's absolutely fine to be out, it's necessary, and it's a welcoming environment. As I said to the dean today, this is so amazing for me to be here with this group. I'm blown away by Western. I'm blown away by your patient philosophy treatment of a One Health concept, of making it holistic. I'm also stunned. When I go into schools, it's usually 90 minutes for the Annie show. My God, I've been here for 2 days. How many presentations have I given, right? And so to me, that's absolutely incredible, all right? Because what it is, this is a whole day dedicated, and I can see, you know, when I go into schools, there's always excuses. They got to be in this clinic. They got to be in that clinic. They got to prepare for a clinic in 2012 and whatever. I mean, it's crazy. But here, all you people are here in this room. And the other thing that's really important, nobody said to me, you can't talk about that, Annie. Or Annie, you can just do something. You can't talk about this. There was absolutely not one utterance of censorship. They had no idea what I was going to say. I had no idea what I was going to say. It's just, that's, right? That's just the truth. But whatever I'm going to say, it's going to be from the heart and it's going to be from experience. So the awareness and the welcoming environment starts from the top. The other thing here is in terms of colleagues. I think on the faculty level, I think it's important to support colleagues, not just behind the door, but in public. That's a huge thing for somebody who's coming out. It's not so easy for people. You know, I'm at the end of the spectrum, okay? I've done a lot of things that are public, but a lot of people are not so public. Furthermore, they don't choose to be so public. That's their own personal decision. So if you're a faculty member, please support your colleagues. If you're a student, you've never walked in their shoes, okay? You're way too young to have that kind of experience that you know everything. Yeah, you have a lot of experiences. You're gifted. That's why you're here. I told you that earlier. But the point is, try to emphasize. Try to put yourself in your student friends, your colleagues' shoes. How has life been for her coming out as a lesbian? How has life been for him coming out as a gay male? How is it for your other friend who's coming out as trans? Do you understand how difficult it is doing this? Do you understand how difficult it is going through dental school? You realize that? So let's make our lives even more difficult by coming out. That's a lot on your plate, okay? And I can't tell you how much support means to somebody transitioning. And I'm not talking about transgender. I'm talking about somebody coming out as gay, lesbian, or whatever. Support is incredibly validating to these people, and it's incredibly needed.
Absolutely.
Hi, Anne, again, thank you so much for day 2 of the Anne Show. It's been great. I am the one pelvic floor PT in the room. I'm from the Health Sciences Department, Physical Therapy. So just from the physical therapy side, I've attended a lot of conferences where we discuss this, and not only from treatment perspective, but what do we do as an academic institution? How do we support our students? And one of the things that was suggested to me was that on your email signature, that you put your pronouns. And as an ally, when I send an email to somebody, they can see that and they say, wow, she gets it. She understands in a sense. And therefore somebody may be more open to share their pronouns with me or share their story with me. Another thing is I've put a poster up in my office that says, we welcome all races, all religions, all countries of origin, all sexual orientations, and all genders. And this is a safe space for you. So I think that identifies you as somebody that's welcoming and is somebody open to talk to. Also from our professional organization standpoint and on a national level, things like registering for the board exams, we've put an alternate gender category for somebody to define what their gender is instead of just male and female. And we've also done that for our professional organization. So when you're registering through the American Physical Therapy Association, you can choose other or identify as you would like. So those are things I think that, as a university are things that we should probably look into. And then, as faculty, we can do that to help support our students.
But among all the good things that she just mentioned, there was a term, 3 words that she said that's so important. Anybody remember what those 3 words especially were? As an ally. Big deal.
I really agree with that. I wanted to add that, you have to realize that sometimes LGBT people, they've been through a lot. Many of them have been kicked out of their homes. I have friends who have been on the street, actually. And you should realize that you might be the first place that's a safe place for them in their lives. And they can change their lives. I have a friend where his dad had identified, or at least thought that he was gay at a very, very young age. And so his dad started beating him up. And he used to pick him up by the neck, and he tells all kinds of really terrible stories about things that his dad did to him, forced him to be in sports and do all kinds of things to try to change him. When he was approached by his parents, they approached him in the kitchen. He was only about 17 years old, forced him to come out to them officially, and they made it sound like it would be a safe thing to do. So he felt a bit relieved, but a bit nervous, and he started to cry, and he told them, okay, you're right, turns out I am gay. His dad said nothing, turned around, went upstairs, came down with a gun, pointed it to his head, and told him that he better leave the house, and depending on how quickly he left the house, would determine whether or not he got his head blown off. And the other thing that he said is, if you tell anybody about what has gone on here, that will determine whether or not I blow your mother's head off. And he and his mother were very, very close. And she knew that this was an issue. So she was all these years trying to support him to a degree, Although I will tell you that her behavior kind of fed a lot of this as well, okay? Now the reason I'm telling you this is because this friend, when he got out of school, so he left the house, he ended up on the street, got involved in some drugs and some difficulty. He was a really bright, talented person, academically, he was an artist as well. And it was when he arrived at university where he found a community that accepted him. And you know, the way he explained it to me is he said, it wasn't just the LGBTQ plus community that welcomed him with open arms, although that was a big deal as well. It's when he actually got out of his community environment, the whole community had these beliefs toward LGBT people. He told a story about a kid who was identified in high school in 8th grade. The whole community bore down on this kid. They identified him as gay. Teachers and everything teased this kid. And one day, the friends in the neighborhood talked this kid into trying to beat a train by riding his bike across the tracks. And the train hit him and killed him. And the community, the way my friend described it is he said, the community, after that had happened, acted like they had no role in that whatsoever. Everybody was shocked, and everybody talked about how wonderful this kid was, but nobody was there for him at that time. So the reason I'm telling you all these stories, I mean, these are really hard stories for me to even tell, is that you may make a difference. This friend now has a bachelor's degree, 2 master's degree, PhD. He's a world-famous professor, lecturer, has an amazing life. And the reason he has that amazing life is because an environment like what we have here right now. He felt for the first time he saw straight people take care of him, you know, ask him questions and not sort of bear down on him the way the community did. So please keep that in mind. And for some of you, it may be a patient, you know, just a little kindness, a little understanding, soft look in your eye, soft touch. For somebody who's had a gun to their head for who they are, you would be surprised what that means. So, thanks. There's a question.
Hello? All right. So you were asking about how it was like for a student, Dr. Kosh. Come over here. Yeah, I'm little. Very hard to see. Right here. Yeah, this guy. Oh. That was from yesterday. So you were asking about like how it's like for LGBT students here, and I've got to say, as a gay student, like it's been nothing but support and love from faculty and students, and it's something that I wasn't really expecting, but it's as if that doesn't even matter to a lot of the faculty, and it's been amazing, just to be treated and scolded just like anyone else. It's kind of it's been just like a really wonderful environment, and I just really want to thank you guys for creating that for us, and also like the students as well. I mean, the students have been so supportive and so loving, and even with the jokes, it's all fun. So
that's what it's about.
Yeah, exactly.
It's about humanity at the end of the day.
Yeah.
Right?
So
and being proud in your institution, and being proud of yourself and your colleagues. And again, as you've noticed, it starts from the top down, and it's clearly evident. So I think that's absolutely wonderful what you're saying.
Yeah. And I feel like it's becoming more and more common for people to come out, like especially in like medical school, dental school, and I feel like it's because, like you said, like these institutions that provide that environment. Thank you guys.
I had a question.
Yes.
Okay, before dental school, I was a dental assistant, and I did a lot of temping throughout my undergrad and all that. So I was able to go to different dental clinics and see what it's like there. And I did see a lot of dentists have a hard time getting dental assistants. But then on the other side, I saw a lot of discrimination for those dental assistants that had already gone through dental assisting school and they thought that that's where they wanted to be. So I saw a couple of cases where there was a gay male interviewing, and he did the job interview, and as an assistant, I was able to interact more with him, I feel like, than the dentist did. And so he seemed great. He seemed like a great candidate for the position, but he didn't get the position, even though that there was a need for an assistant. I then asked the doctor, because I got pretty comfortable with them, and one answer I got one time was that because of the patients that go there, they wouldn't feel comfortable being treated by a male gay assistant. So what do you think can be done for, I mean, we're getting educated now, so I'm sure when we go out there, we won't, that won't happen to us. But for those dentists that didn't have courses like this and weren't aware of what we're being taught today, what do you think can be done for those dentists to avoid stuff like that?
Okay, again, this is the whole option about the politically correct or the real world answer. Right?
Real world.
And about the real world answer. One of the problems that medical schools and dental schools, when you have days of diversity training, the same people always show up. The people who should be there, they never show up. And that's a problem, because the people who need to be educated in terms of tolerance and accepting people with different color skins, different beliefs, they never show up at the functions. And so what happens? They continue on with the ways. It's a real issue. And I just don't see, I don't know if Code or anybody's going to mandate that. I don't think that can be mandated to absolutely, you have to attend it. It's strongly encouraged, but strongly encouraged results with the same people showing up. So for me, of course, it's an education issue. But in an academic environment or a state school, places like that, there's only so much that you can do making these people come to the well. The way you can work with that is kind of through just non-regimented and non-regulatory, non-regulated courses or instruction. But you know, that's generally not that effective. So there's some people that are just going to be like that, and you have to deal with them. As I said, one thing in terms of women's issues or people's issues in terms of snide remarks, that's different. Because if all of a sudden you have a faculty member part-time or full-time, and they're physically treating people a certain way or saying certain things, that's different. If they have a belief and they keep that to themselves and they just continue to harbor that belief, it's very tough to have any kind of action against them, other than hopefully they're going to get it. But in most cases, they end up not getting it. That's the truth.
How about one last question here?
Thank you for being here, Dr. Koch.
Yeah, okay.
First of all, thank you for your service. And I just discharged the Army this February. And
yeah, all right,
Mike. As a gay soldier, I know that a lot of transgender friends has a lot of issue in the Army, and they kicked out the Army, and even we cannot use the restroom. So, as a veteran, do you have any idea for supporting the LGBTQ veterans? I'm so sorry. Any plan or ideas to help LGBTQ soldiers or young veterans? Do you have any plan or?
Well, there's a number of associations. There's a whole group of transgender veterans. You can Google all of these on the internet. The TCNE, that's the Transgender Center for National Equality. They have a number of websites listed for people who've been in the services. I think the other issue here, having spent 10 years in the Air Force, maybe I was just lucky being in the Air Force, but whether somebody was gay or lesbian and trans, that was a total non-issue. I was at a base where we had an incredible nursing corps. Everybody knew probably 80% of the nurses were lesbian women. Nobody could care less. They were incredible women. They were incredible nurses. I would go into some of the basic, the accounting aspects where you would have kind of organizational people. And I could tell by the length of their fingernails, there were a couple of young black guys who were like kind of trans people. Nobody could care less. They did a great job. They were wonderful. It was a non-issue. I think what has happened here is that this has become politicized. Remember my story about the individual who was the West Point graduate? Did you hear me tell that story? About transitioned, and then the Army was completely supportive of this person. Now, it was a little bit different because this person's a West Point graduate and was an officer. That's got to be the same whether you're a first lieutenant or whether you're a staff sergeant. There's no room to making that discrimination. What has happened, I think, with the politics in Washington, it's made the military become a little bit more of a fearful place for LGBT people than it really had been in the past. The other thing that I have found about the Army and the Air Force and the Navy, it's so much dictated by your commanders. It's so much by the commanders. If you're working in a facility, whether it's in transportation or whether it's in air maintenance or whether it's at the hospital, and you have a commander who's really a jerk, that creates a lot of problems. But if you have a commander who's completely on the different side of it, it's a non-event. The problem is legislating stuff like this across the entire service. I don't think they still haven't resolved the transgender issue, okay? That's really an issue. They had one surgeon do a surgery that was paid for by the Pentagon, and that was it. And I think that's not going to change in one way or the other until there's a political change. But to me, there's plenty of places, there's a number of organizations that are very supportive for LGBT veterans. And there's also a couple of organizations for transgender veterans. And what they're trying to do is they're trying to change things in terms of separation papers, because there's certain documents that when you separate, you can't change your name. I know one surgeon, a trans woman like myself, actually her last day in the Navy, she changed the name. She changed the name from a guy's name to a woman's name. Last day in the Navy. And so she did that because all her separation documents have her feminine name. So if she had waited a month and tried to go back and change, she couldn't change it. That's the work that attorneys, activists are trying to do at the military, is have some of this paperwork done so that if somebody does transition gender, they can go back and they can actually alter the names on their separation papers. In terms of how the LGBT individual is treated in the service, I've seen both extremes. Most of the stuff I've seen in the Air Force has been incredibly positive. It was a non-event. I mean, it truly was a non-event. Where you are in the Army, at what base you might have been different. But to me, in the Air Force, I had nothing but a really positive experience. I wasn't out trans there, but I had a couple of people I knew were lesbian and gay individuals, and they just did the job like anybody else. So where it goes, I cannot tell you because it's so much a political issue. For instance, the current Secretary of Defense, I don't know how long he's going to be on the job. And I think he's actually a little bit more open-minded maybe than others in the administration, but I don't know how much longer he's going to have at the position. I don't know if that answered your question. No, so just rephrase me the question again. Do I have any plan? Right.
we all the time have to deal with. And then still after the government changed it, a lot of government in the military no more supporting the LGBTQ soldiers anymore. So a lot of soldiers right now have a jeopardy for the kicked out army, or I'm not sure the other branch, but in the army that we have a lot of issue with.
No, that's an issue. That's an issue, and all you have to do is be in a situation where there's one complaint from a man or a woman for a trans person, and that makes it a really difficult place. Now, you know, the military is not a democratic institution, and the military does a lot of things really well, like mass education. They're incredibly well at that Army, Navy, Air Force. But in issues like that, my experience has been with the military, they're going to go with whatever's going to create the least amount of ruckus. So in a case like that, it's like there's a joke in the Air Force about 18-year lieutenant colonels. They're called roadies. Roadies is an acronym for retired on active duty, right? They don't want to do anything. They don't want to make any commitment because all they're trying to do is get the 20 years in a retirement, okay? In the service, when you have a situation where you have male and female bathrooms, if they don't want to make a non-gender specific bathroom, if they're going to still make it strictly binary bathrooms, that's going to create an issue as soon as somebody complains. And what they're going to do then is they're going to go back and make it very strident and very, very difficult. So what happens on that with the military, that's going to have to start from the Secretary of Defense instituting changes in terms of how personal hygiene and deportment is delivered. And that's totally at the whims of politics.
All right. Thank you, Dr. Koch.
All right. Yeah.